So I just came out of my patient Harry's room and he's complaining of nausea. So I am having a look at his MAR. I'm in the med room right now. And he does have a PRN Q6 for diamond hydronate, which is for nausea, and he hasn't had it yet today, so I can give him that. So I will take that out of the med cart, and that'll be my first check. So diamond hydronate, and it's 50 milligrams a milliliter, and it expires December 2030, so that's my first check. I will have to do the math. So the dose desired is 25 milligrams divided by dose on hand, which is 50 milligrams per milliliter equals 0.5 milliliters. Great. So the next thing I do is my 7 checks, which is my 7 rights of med admin. So it is for Harry Wilson, right patient, right drug, diamond hydronate, and I'll be giving him 25 milligrams. That's the dose. The route is IM. The time, it's 9:30 in the morning. It's a PRN med that he hasn't had, so that's all good. And right reason for nausea, and for documentation, I will just put a dot there saying that I'm drying up the med. So I'm just gonna do quick hand hygiene before, and then first thing I'll do is take off the cap of my vial. Set that aside, and I will clean the top. Then I'll take my syringe. And the filter. I'll take the cap off, and because he's getting 0.5, or sorry, 2.5 milligrams, it's 0.5 milliliters on here, so I'm going to draw up 0.5 milliliters of air. Then I'll inject that in, turn it upside down, inject it, and then I will pull back the amount. And I'll put my cap back on. And then I'll put on my needle. And I have a label made up. Okay, so my third check will be disposing of all of this, and then in sharps, and then just triple checking that that is the right med. So diamond hydronate, and it's not expired until December 2035, so I can put that back. Again, I'll just do a quick hand hygiene, and I will also mention that I had my instructor check my math, so you know that's good. Put on a pair of gloves. And then I will take a needle, an alcohol swab to clean the site, and my MAR to the bedside. Hi there, Harry. How are you feeling?
I'm just a bit nauseous.
A bit nauseous? Okay, so I have some medication for you for that. But first I'll just need your first and last name.
Harry Wilson.
Okay, and your date of birth?
September 22nd, 1946.
Great, and do you have any allergies?
No, I don't have any allergies.
No? Okay, I'm just gonna confirm that on his bracelet, and that's correct. All right, Harry, so are you okay if I put it in your shoulder here?
Yep.
Have you had that? Okay. So I'm going to landmark that, which is just finding the acromion process here on like the shoulder bone, and then 3 fingers down, and then I'll make a V. So it's in that little spot right there. So I'll just grab my alcohol swab, clean the site. Okay, and I will let that dry. And once it's dry, I will pull back the skin, make sure the bevel is up. So pull back the skin, and at 90 degrees, dart-like, I'll go right in the spot, stabilize it, push the medication in, take it out, lock it, dispose of this in the sharps. How was that, Harry?
It was okay, thank you.
That was okay?
Yeah.
Okay. So then I'll just quickly document that with the time and my initials on the MAR. All right, Harry, I hope that works. I'll come back in just a little bit to check on you, okay?
Okay, thank you.
All right.